This is Georgia Focus Extra. Cavities are the number one chronic disease for children in Georgia. According to the Academy of General Dentistry, more than 51 million school hours are lost each year due to dental-related illnesses. Pediatric dentist Dr. Shannon Parris says it's easily preventable.
Tooth decay, as you said, it is one of the most common chronic diseases among children in Atlanta and truly in the United States. It's the most preventable, according to the Centers for Disease Control and Prevention. However, because of our habit, we eat constantly, we're constantly snacking or drinking, our teeth are then being exposed to sugars, to acids in the foods, and that's what causes the cavities. We don't typically travel with our toothbrushes, so that food just sits on the teeth and or in between the teeth, and if not removed effectively in a timely fashion, it will sit there and cause tooth decay.
Are the parents just not making them brush?
I think that parents are overall very concerned and, in most cases, involved in their children's oral hygiene. I think that the idea that a baby tooth is a baby tooth and it's going to fall out anyway gives a false sense of security. And that if I don't brush it, it's no big deal. It's going to fall out anyway. So sometimes the energy isn't behind cleaning the patient's teeth, baby's teeth, or at least understanding what can happen if teeth aren't brushed.
Anything to do with socioeconomics as far as what you eat? Maybe you don't eat as healthy foods, and so you don't have as healthy dental health. Do you see a correlation there at all?
Well, I could definitely draw that correlation. However, and unfortunately, tooth decay does not know socioeconomic levels, so you can definitely get tooth decay whether you are the queen of a country or not. The same thing causes cavities in everyone. Exposure, frequency, and unfortunately, improper oral hygiene. If I find that I have patients in a lower socioeconomic level, what might be missing is access to care, access to the education and the information. And for those who might have access, there is access to maybe more sugary treats or what have you that can cause decay. So I think that overall, those of a higher socioeconomic background might have better knowledge. The education might be there to prevent, but it doesn't 100% isolate them from the incidence of dental caries.
What are some of the tips that you would have for parents on how to prevent cavities?
The first visit is recommended by the age of 1 or 6 months after the first tooth comes in. A lot of times parents might hear, the first visit doesn't have to be until 3, or just wait until the baby is old enough or the child is old enough to sit in the chair and be still. That can ultimately be a detriment to the child. So we like to encourage pediatric dentists and pediatricians should definitely encourage their parents to bring the children in by the age of 1. That educational appointment will serve 2 purposes. 1, to take a look at the child's mouth to see how the teeth are developing and to talk to the parent about oral care. It's very important to brush a baby's tooth, and we encourage the parents to use a toothpaste in a very young child with no fluoride. If the baby at that first appointment is still in the bottle, we definitely talk about the effects of babies going to sleep with the bottle, and we talk to them about the snacking and the drinking, dilution of juices, not to send the baby to bed with the bottle, and just the importance, whether there's 1 tooth or 10, they should be treated the same, brushing, and if they're close together, flossing. We encourage patients, children, to come to see their dentist every 6 months. In 6 months, things can happen. Cavities can form. If you miss a 6-month appointment and you don't come back for a year or a year and a half, that small cavity can turn into something big, and that can cause an unpleasant appointment for a child. An unpleasant appointment can set the tone for that same child as an adult. And we want to encourage early visits and education so that every appointment can be a happy appointment.
That's Dr. Shannon Parris, a board-certified pediatric dentist at Great Expressions Dental Centers in Snellville. I'm John Clark, Georgia News Network.